Hello, everybody. This is Dr. Archana Shrestha. I am one of the co-founders of the Women in White Coats and co-authors of the Chronicles of Women in White Coats. And I am so excited to be talking today with Dr. Anu Kathiresan. And she is a physician who practices, she's an infertility specialist who practices at the Center for Reproductive Medicine in Houston. And she is also the Director of Patient Education and Fertility Preservation for the Center of Reproductive Medicine, where she works. So we are really excited to have you on here today, Dr. Kathiresan. And one of the things that we actually wanted to talk about is a recent blog article that you wrote for our blog, The Women in White Coats, about, it was called Doctor Not Mrs. Don't call me Mrs. I think is how we, it's doctor. I think that was the exact title of your blog. But anyway, we wanted to talk a little bit more about that because you are in a unique position where you are married to another physician. Mm-hmm. And so just wanted to kind of talk on that topic and hear your thoughts about what kind of led you to write about the topic of, you know, being how sometimes you're addressed as Mrs. instead of doctor.
Yeah, well, first, thanks for having me. I really appreciated the invite. So yeah, the inspiration of the story kind of started with me just wanting to share my experience being married to a physician and some of the kind of life challenges we experienced in the course of our training. Some of that was that we were separated for 3 years in our training. I was in California and he was in Florida, so we were on opposite sides of the coast of the country, and we also had a kid while we were separated. So I was a single mom for 8 months, and so I just thought the story was unique and just something I wanted to share, and so that's where the initial inspiration came from. And then I was just kind of reading and thinking about gender disparities in the workplace around the same time, and just kind of thinking about instances where in my life where I'm mistaken as a Mrs. The kind of two scenarios that came to mind were like on wedding invitations where from my husband's colleagues where it says Dr. and Mrs. and they know he's married to a physician. So things like that, or at his work party where they assume I'm his wife, and I'm like, no, I'm a physician too. So scenarios like that, and it just kind of became a blog talking about, well, then I kind of sat back and thought about, it was interesting in the sense that I think in our training, I made a lot of sacrifices, and like some of which were when I chose residency, he was an early match. So he determined where we were going to match. And I really wanted to do infertility. And so I really wanted to go to a program where there was an REI fellowship. And of course, he matched at a place where there was no REI fellowship. So then I had to, decide, did I want to follow him or not? And so I kind of made a sacrifice a little bit in my career choice and did follow him. And then also what I already spoke about where, we were separated and I had a kid. So I felt like I made a lot of sacrifices in the course of my training. And then it's funny that I'm the one that's mistaken as the Mrs. And so that's kind of where the inspiration came from.
Yeah, I mean, I think that especially after all the years of training, that, for your husband to be called doctor, he did a lot of training too. I know he's a neurosurgeon. I don't know if we've mentioned that already, but you did as well. And I mean, how many years of training was it for you?
So for me, it was 7. And for him, it was 9. So he did 2 fellowships actually, and they were additional 1 year each. So he did 9 years, and we both have passed all our board exams, but I was required to actually take 4 because I had to do general OBGYN and also my subspecialty in fertility. So I had to take a written and oral exam for both. And he actually only had to do 2 board exams. So I kind of give him a hard time that I took more. But yeah, I think overall we did similar amounts of training and exams and everything. And so, yeah.
Yeah. So, I mean, how does that make you feel though, when, you put in all those years of training and, obviously your husband did too. However, I mean, in the eyes of other people, like he's being regarded as, instead of Mr. and Mrs., it'd be one thing if you're both called Mr. and Mrs. on an invitation, but when he's called Doctor and you're called Mrs., how does that make you feel?
So initially, I was frustrated with that, and it was funny because I guess it's happened so often now that I had become complacent to it because I felt like at some point it became the norm, that it would say Doctor and Mrs. And when I thought about it, when a friend of mine would invite me to a wedding, they would get it right. They would say Dr. Kathiresan and Dr. Johnson. And we actually, don't have the same last name because I didn't take his name. But I used to get excited when it was actually correct. And so that's kind of, how the evolution of how I felt about it.
Mm-hmm. Yeah. And does it happen often then that, so it sounds like more like his family or friends are the ones kind of making that mistake.
Yeah, and it may not be necessarily intentional, maybe like the secretaries or something like that that are putting together the invites, and that's why it ends up getting missed. But yeah, it happens, fairly frequently when it's his work related, in terms of work parties and invitations and that type of thing. My friends, not so much.
Yeah, I mean, I think also, especially when, you have a male physician, so, maybe even because he's a surgeon, their expectation almost is that there's somebody at home taking care of the kids and who's not, doesn't have a career maybe. That may be kind of maybe what is more commonly seen, and maybe that is part of the bias that you are seeing. I don't know. What are your thoughts on that?
So I do think that, back in the day, it was more men in medical school, men applying to medical school, and the woman was perceived as the wife that, would stay home or have another role of some sort. So I think that idea is changing because now we see more women becoming the majority in terms of applicants to medical school. So maybe with time, we'll see a change in that. But yeah, I think that was a assumption from, kind of traditional norms. And so it's hopefully something that will change.
Yeah. So what do you think is kind of like the larger implication of all of that? This kind of assuming that the woman is staying home and not doesn't have a career of her own, or that your husband isn't also married to a doctor.
Yeah, I would say that it's important, I think, as, medicine is changing and as more women are entering the field, that we acknowledge that, and that we acknowledge that the woman is just as capable as a physician and as a surgeon. So I think that that's something that's important, and hopefully with time that will change and evolve. So.
Yeah, definitely. And so what are some of the challenges, that you guys have faced being in a dual physician family? Like here on Women in White Coats, we talk a lot about lifestyle, and I think a lot of women who are considering going into medicine are really curious about the lifestyle and how we balance it all. And it certainly is possible, right? I saw it a lot in my own medical school class where people met their future spouse in medical school. So I'm sure you saw that a lot as well, that there were a lot of dual physician families. So what are some of the both challenges that come up with that, as well as the maybe some pluses that come along with having a dual physician family?
So I would say some of the challenges is that, so my husband and I are pretty subspecialized. And so, we followed our passions, and, we have no regret with that. But we did encounter challenges with being so subspecialized. Because like, for example, in our training where we had to spend time apart, because where it was good for me to train wasn't necessarily good for him, and vice versa. And same thing with finding a job. So it can be a challenge. The other things that come to mind in terms of challenges are just balancing the household. We've had the luxury of having my parents live with me for the last about 22 months, and that was amazing. We have three little ones. They're 4.5, 3, and 22 months right now. And my parents actually just left because, they kind of hit their time limit on helping. So we're super grateful for, their help, but are realizing now, more so, than before, the struggles of balancing the household. And so, thankfully, my husband's, so he does vascular neurosurgery. So he takes care of strokes and things like that in the middle of the night. So his schedule is more demanding and middle of the night type stuff. So thankfully, my schedule is more clinic. And so I'm able to balance the kind of home stuff more. And so, I mean, it's still something that we're not experts at by any means, but we're able to balance that because I'm kind of the more flexible one in terms of the work schedule. And then in having young kids, childcare is always can be a challenge, especially when you want to do a date night, and spending time with your spouse can be a challenge when he's, tired and had middle of the night procedures all week. So finding time for your spouse, juggling call schedules, his call schedule, my call schedule, who's going to watch the kids, these are kind of the challenges we face. So, but we just do our best to communicate. I try and weekly communicate, like on Sundays, what's your schedule like, so that I can try and plan things out more. Even finding time for like gym and errands can be a challenge because somebody's got to juggle the kids somewhere. So we just try and communicate once a week before the week starts, so we know who's where, and we can kind of plan things more in advance. And also once every 3 months, we try and, if we want to try and plan a vacation or a weekend away, and I think communication and planning are key.
Yes, definitely.
And so I guess in terms of your other question, did you want to stop me? Sorry.
No. Go ahead. Yeah, just talk about benefits, maybe. Yeah.
Yeah. So I would say some of the pros are the duplication of salaries is helpful in the sense, like if something were to happen to me or him, having the reassurance that, somebody else can be the backup, for, God forbid, one of us becomes disabled or something like that, so having that reassurance is definitely something we are grateful for. And when we went through training, that can be a very rigorous, demanding, lifestyle. And so I think having somebody else that has been through it can understand, there are times where I haven't seen him in 3 days, and it's, something that, I know he's working, and I know he's busy, and I know he would be at home if he could. And so I'm understanding of that, so I think when someone else has gone through it, that can help. And I think it's cool also for the kids to just see mom and dad both as working physicians. I think that's also a pro that they see that, so.
Yeah, definitely. I could see, you guys can relate to each other and what you're going through, and when, whether it's a difficult patient or being on call and what's that like, or maybe difficult interactions with staff or whatever it may be. I think that is definitely a plus because you guys can relate, and know what it's like to go through that.
Exactly.
So, I just was, one last question I wanted to ask you was about your article that you wrote. And I know you started a hashtag campaign called Dr. Not Mrs.
Mm-hmm.
And I was just curious how that went, and what were some of the other stories that were shared as a result of that? Because I think basically the idea was for people who are also dual physician families to write their story and share their story on social media.
Mm-hmm. So it was interesting. I really wasn't sure how it would be perceived. And I felt like the response I got kind of fell into two categories. And so one was people that were equally frustrated, with being mistaken as Mrs. And not doctor, especially in, professional settings. And then I felt like there was a whole other kind of group who really embraced both titles. And some even suggested changing the hashtag to Dr. and Mrs., which I actually thought, I could totally relate to that too. But it was funny. Everything can be perceived differently by different people. So some people, Dr. and Mrs., perceived that as still the wedding invitation, right? And that's being the doctor as the male and then the Mrs. as the woman. So I ended up just going with the hashtag that was my initial inspiration for the blog. And so that was the doctor, not Mrs. But I did think it was interesting and kind of cool that there were so many different takes on it and perceptions on it. And so I thought that was, great for just increasing the conversation about it, and that there's not, a right or wrong with it really anyway. But yeah, some of the other stories that people shared were things like being in a practice where it was maybe mostly men and the woman would be called by her first name, whereas the men were called doctor. Situations maybe where there's a team of people and the woman was perceived as any other person of the team except the doctor, or that was maybe the last thing that they were thought to be when they're actually maybe, running the whole team. So those were the type of stories that I encountered, and I thought it was really, really inspirational to see kind of the response, so I really was, happy to see that.
Yeah, absolutely. I mean, I think that this gender disparity is still very alive and well in this day and age, unfortunately. And we need to definitely, I love that you started that campaign to kind of raise awareness that, like, yeah, you can be a doctor and a Mrs. Or, in certain situations, you are the doctor and not the Mrs. Kind of like for me, I am a doctor as well. I'm married to a non-physician. But in my personal life, I'm very fine being called Mrs., but if anybody at work called me Mrs. instead of doctor while they're calling all the rest of the people doctor, all the other physicians doctors, it would definitely really, bother me because, like you said, we've done the training as well. But I think it just was such a good hashtag campaign to do, and just a great article that you wrote, because it really just raises awareness that, as women, we can wear multiple different hats and, of course, have successful careers as physicians. I thought that was such a great campaign, and just a way to raise awareness and to hopefully also help, change this disparity and kind of the perspective that people have and the stereotype that of the male physician. And like you said, the medical schools are changing, where there are now majority women enrolling in medical schools. So hopefully more and more people will see that, that we could be the stereotype too, that women doctors are the stereotype, hopefully one day.
Yeah.
Well, thanks so much, Dr. Kathiresan. This was fabulous, and it was so great to talk with you. And we look forward to reading more from you and hearing more from you on the Women in White Coats blog.
Oh, great. I can't wait. Thank you so much again for the opportunity.
You're welcome. Have a great rest of your day.
Okay, you too. Bye-bye.